Hello everyone. I'm going to discuss on the female external genitalia. My name is Dr. Ominde. So the female external genitalia is composed of the mons pubis, labia majora, labia minora, the vestibule of the vagina, the clitoris, bulb of the vestibule, and the greater vestibular glands. So that's the mons pubis, where hair grows. Then the outer lips are called the labia majora, followed by inner lips, labia minora, and at the upper tip we have the clitoris. Then we have the vestibule, which is the opening that has the urethral opening and the vaginal opening. And the vagina has a hymen, and then as you go posteriorly, that's the perineum and the anal canal as part of the perineum. So this is clearer, the mons pubis, where hair grows, then followed by labia majora, the outer lips. The inner lips are the labia minora. Then this whole region is a vestibule, okay, with the urethral opening. You can see the skin gland orifices there, the vaginal opening with the Bartholin's gland or the greater vestibular gland opening there. And that's the hymen ring. So again, that's the opening of the urethra and the vagina. That's labia minora, and this is labia majora. So the mons pubis is the rounded median elevation in front of the pubic symphysis, and it's just an accumulation of fat. Usually on its outer surface, it's covered by coarse hair after puberty. The labia minora majora are two elongated folds. Labia majora are two elongated folds that run downwards and backwards from the mons pubis, and they're usually covered by skin and sebaceous glands with coarse hair after puberty. And the inner aspect is usually smooth and hairless, with its subcutaneous tissue mostly composed of fat. The labia majora contains a termination of round ligaments, has some smooth muscle cells with some neurovascular bundles, and the labia majora is homologous with the male scrotum. Labia minora are two small skin folds between the labia majora at either side of the vaginal opening. They join the middle aspects of the labia majora, and in a virgin, labia minora are connected with each other by a transverse frenulum of labia or a fourchette. They are devoid of fat, and the skin covering the labia minora is smooth, moist, and pink, and labia minora are usually hidden by labia majora except in children and in menopausal women. The vestibule is a cleft between the labia minora. It contains the openings of the vagina, urethra, and the ducts of the greater vestibular glands, which are also called the Bartholin's glands. The external urethral orifice is situated behind the clitoris, immediately in front of the vaginal orifice, usually a median cleft and margins that are slightly averted. So that's the urethral orifice, and skin gland will open at the orifice. That's the vagina, and openings of the Bartholin's or greater vestibular glands open there. The vaginal orifice is larger than the urethral orifice, and the size and appearance depend on the size of the hymen. There are two ducts of greater vestibular glands or Bartholin's glands that open on each side of the vaginal orifice between the labia minora. Smaller openings for lesser vestibular glands are in the vestibule between the urethral and vaginal orifices. Again, that's the urethral orifice, and that's the vaginal opening with the hymen around it. So that's labia minora, and the outermost is the labia majora. Location of clitoris and the clitoral hood at that area. So this picture shows is the types of hymen that you can have. So in a virgin, that's how it looks like. You can have a biperforate hymen, imperforate hymen, where the vaginal orifice is closed. A deflorated hymen looks like that, and you also have a cribriform hymen with small perforations. The crura, most of the crura is hidden by labia minora, usually arises from the body of pelvis by two crura, and near the lower margin of the pubic symphysis, the crura usually turn downwards. The corpora cavernosa together form the body of the clitoris, and they're usually enclosed by densely fibrous envelope of connective tissue, and these are separated from each other by an incomplete septum. The clitoris consists mainly of erectile tissue. It's capable of enlargement as a result of engorgement with blood and is not traversed by urethra. Usually, the clitoris is located behind the anterior commissure of the labia majora. The glans of the clitoris is a small rounded elevation on the free end of the body and consists of erectile tissue and is highly sensitive because it has abundant neuronal endings. Suspensory ligament of clitoris connects it to the front of the pubic symphysis. The bulb of the vestibule is a paired elongated mass of erectile tissue that lies at the sides of the vaginal opening under cover of bulbospongiosus muscle. It's broad behind but very narrow in front and usually unite with each other anteriorly to form a thin strand which passes along the lower surface of the body of the clitoris to the glans. The greater vestibular gland is also called the Bartholin's gland, are two small rounded ovoid bodies that are located immediately behind the bulb of the vestibule. The duct of each gland opens into the groove between labia minora and attached margins of the hymen. The greater vestibular glands are homologous with the bulbourethral glands of the male. They are usually compressed during coitus and secrete mucus, and this lubricates the lower end of the vagina. The blood supply of the female external genitalia is mainly from internal pudendal artery, which is a branch of internal iliac artery. Also, the female external genitalia is supplied by superficial and deep external pudendal arteries, which are branches from the femoral artery. The venous drainage of the female genitalia corresponds to the arteries mentioned above. The external genitalia in female drains into the inguinal lymph nodes. The skin drains into the superficial lymph node, which later take the lymphatics to deep inguinal lymph nodes and femoral lymph nodes. The deep inguinal lymph nodes, also called the cloaquet nodes, drain the clitoris directly. The female external genitalia is supplied by pudendal nerves, iloinguinal nerve, genital branch of genitofemoral nerve, and posterior cutaneous nerve of thigh. Thank you very much.